Doctor, can we start, Doctor?
Yeah, sure. We can start.
Good evening and namaste to Dr. Gautam Sudhakar, resource person of this evening, Mrs. Nisha from NIMHANS, who is providing online and offline support for conducting the webinar, Dr. P.T. Sudhakar, Head of Geriatric Psychiatry Department of NIMHANS, and his team of doctors who are responsible for this webinar, the enthusiastic and inquisitive viewers, participants of this webinar from across the country. I have great pleasure in welcoming you to yet another edition of this webinar being organized by Vayomanasa Sanjeevani, an outreach arm of Geriatric Department of NIMHANS, Banglaore. I would like to provide a brief overview about Vayomanasa Sanjeevani. Most of us know about National Institute of Mental Health and Neurosciences, shortly known as NIMHANS. NIMHANS is world renowned as a center for mental health, neurosciences, and allied field. They have geriatric care as a specialized field, and in that department, they have started the webinar services to create awareness to people at large about the developments in the field so that they can be benefited. I am happy in welcoming and introducing to you Dr. Gautam Sudhakar, resource person of this evening. He is young, highly educated, and experienced doctor. After finishing his MBBS degree from Indira Gandhi Government Medical College, Pondicherry, nowadays known as Puducherry, the year 2016, he joined for MD in All India Institute of Medical Sciences, Jodhpur, and completed in 2021. As regards his experience as a specialist, he is working as a senior resident in Geriatric Psychiatry Unit of NIMHANS, Bangalore for the last 2 years. He is treating seniors who have psychiatry disorder. Earlier, he has worked in community psychiatry unit. I am sure his vast experience in the field has given him enormous knowledge to talk on today's topic, that is stress management elderly, as stress appears to be the most important cause for many of the illnesses. I understand that the important reason for Dr. Gautam to choose this field of super specialization is his desire to serve the elderly population. I appreciate him for the bold decision taken to specialize and serve the seniors who, according to us, is not a favorite section of the society for the medical field. We feel so. We are not very sure about it. So as a time management tool, and I request participants to ask their questions, if any, in chat box for doctor to answer. As he is the resource person, I request him to give all his inputs to us so that after taking all the input, we can also raise questions to him. You may also raise your doubts after the resource person finishes his presentation. Yes, Dr. Sudhakar, we thank you for your desire to share your knowledge and experience with us today by spending your valuable time. Please go ahead with your presentation. Thank you, Doctor.
Thank you, sir, for your introduction. So I would like to make this presentation more interactive. So you can stop me at any time, and when I ask anything, you can respond by unmuting yourselves. So before starting the presentation per se, I would like to tell something regarding the mental health scenario of our country. So in NIMHANS, we did a survey in 2015 and 16. It is not a national mental health survey. It was done, we surveyed around 12 states of the country. And from that survey, we found that the prevalence of mental illness in our country is around 10%. 10% means if you take 100 people, 10 of them will be having mental illness. It is very huge, 10% of the population. So here we are around 30 people. So the prevalence of mental illness as per roughly around 3 of us may be having mental illness or disorder. And apart from that, we also found that the treatment gap. Treatment gap is the number of people who are having mental illness who are taking treatment at least once. So we found that treatment gap is very huge. Only around 70 to 80% of the people who are having mental disorders are not at all taking treatment at all. So only 10 to 20% of them are consulting to a psychiatrist or some other a medical doctor for any treatment. Only 10 to 20%. There could be multiple reasons. One major reason is lack of awareness regarding mental illness and or mental disorder. Other could be various factors like stigma and other issues. So, so today I am going to talk regarding stress and its management. What is stress? How we can how to identify the signs of stress. If stress is not controlled, what it can lead to, and how to manage stress. Before that, I would like to ask you one question. Do you know? Can anyone tell whether stress is a normal thing or whether it is an abnormal thing? Whether it is normal or abnormal? Can anyone of you?
Doctor, our thinking is that stress is a very, very normal one. It is
Yes.
needed for everybody because stress is also a motivational factor.
Yes, you are absolutely right, sir.
Thank you, doctor.
So many people think that stress is abnormal, but what sir rightly told, stress is a normal thing. It is a normal physiological mechanism. Actually, stress increases our productivity and improves our concentration and all. So it is needed, but when it is out of proportion, when it is required more than which is needed, and if it persists for longer time than it is required, then it will create various issues. First, I will like to tell that stress, if it is more than required, it may lead to mental distress. There is something called as some terminology called as mental distress. I will come on it. And if it is further more, then it can lead to mental disorder or mental illness. So all of you know what is mental disorder or mental illness. Like you would have heard various mental disorders like depressive disorder, anxiety disorders, and psychosis, which includes schizophrenia, bipolar illness, obsessive compulsive disorders. All these are some examples of mental illness or disorders. There is something in between called as mental distress. Mental distress is a condition where, because of stress, we will have some symptoms, but these symptoms are not severe enough to be classified as mental disorders. For example, the person may have symptoms like sleep disturbance, on and off sleep disturbance, on and off low mood, on and off anxiety symptoms, but it is not persistent and pervasive, and is not impairing the socio-occupational functioning of the person significantly. But it can affect the person's health and its functioning, but not that significantly, and the symptoms are not severe enough to be classified as mental disorders. So this terminology called as mental distress became popular during the COVID times, because during the lockdown people are alone in the home. They are not able to earn because they are not able to go for work. This mental distress terminology became popular during that time. And so we don't have exact data of the prevalence of mental distress, but roughly 30 to 40% of the population is having mental distress. 30 to 40% is a very big population. These people who are having mental distress may not need medications, but they require psychological support is needed. And if we don't treat that, or if we don't provide those support which are needed for these people, they can end up in mental disorders, which need medical treatment. They may need psychotherapy or pharmacological treatment may be needed for those patients. So it is very important, but to address the mental distress. But the problem with the current scenario is that we currently in India, we don't have enough resources for those who are having mental disorders as well. the number of psychiatrists or psychologists and or psychiatric social workers and psychiatric nurses are very less compared to the huge population of people who are having mental disorders. So for treating 30 to 40% of the population who are having mental distress, we definitely don't have any resources currently. So we are from NIMHANS, we are doing various programs. Like we are doing one program called lay counselor online certificate course for lay counselors. Here we will teach the lay people how to identify people who are having mental distress and how to provide basic psychological support for them. These are the few initiatives done from NIMHANS, and also we are training other cadres of people like nurses, pharmacists, PhD doctors to provide basic psychological support who are coming in contact with them. So coming to the presentation per se, if anyone of you has any doubt, you can ask. Whether if I am too fast also, you can interrupt me.
Anybody wants to say anything, sir? Is doctor very fast? We are able to follow him. Ramnath?
Okay, it is all right, sir. We can follow, sir. Sir, we can able to follow. No problem.
Yeah,
No problem.
Thank you very much.
Okay, that helps us. Thank you, Dr. Go ahead. Please go ahead.
Okay. So here we will discuss what is stress, various causes of stress, as already I told you, reactions in response to stress, healthy and unhealthy ways of dealing with stress, and finally we will touch upon sleep disturbance and sleep hygiene. So as already I have described that stress is a normal and natural reaction to everyday activities. It helps us to be positive, alert, motivated, and avoid dangers. The problem is that when stress is experienced continuously or experienced out of proportion, then it may lead to mental distress and later mental disorder it can lead to. So what all are the causes? There could be n reasons for stress. For elderly, it could be one main reason is after elderly, we are referring to people who are above 60 years. So for elderly people, one major reason could be because of physical illness. They could be having multiple diseases, like they could be having diabetes or other newly diagnosed disorders. That could be one thing. And there may be no one to take care of them. They may be living alone, family members or their children may be working in the abroad, and so they may be getting very less support from their family. That could be one reason. Another reason could be the economical issues, because those who are above 60 years may not be working currently. They may be depending only on their pensions. Economic reasons could be there, and interpersonal related issues could be there, and any end reason could cause stress. So how our body responds to stress? So our stress can affect our physical, mental, and as well as it can affect our behavior. So first of all, if a person is having mental distress, stress can initially cause mental distress, then only later it can lead to mental disorder. So mental distress, as I already told, they may have some disturbance in sleep. Sleep may be decreased, or they may be having difficulty in initiating the sleep or maintaining the sleep, or they may wake up early in the morning. In the continuation of the sleep, there may be difficulty, and one is sleep, and other could be their appetite changes will be there. They may not be feeling hungry. They are not. That could be one reason, and another reason like mood symptoms. They may get sad often, and they may get irritable without any reason. And because of irritability, they may sometimes it can lead to physical altercations. It can also lead. And another good reason could be loss of concentration, not able to focus on things, and negative thoughts they could be having, and worry for each and every small things could be there. And another common reason, especially in the elderly, we can find that they may be coming to us with various physical symptoms. Like they could be having multiple body pains, headache, pain in the legs, but it is non-specific. Body pains, pain in the neck, back, arms, head, like that, but it is not, there is no physical cause. They would have gone to multiple doctors, and they would have told that nothing, no problem, there is no physical cause for the same. So this multiple body complaints is one common symptom of stress. Because of stress, this symptom could be there. And another, burning sensation in the chest and stomach. It could be fatigability, tiredness, and and as already I have told, it could be trouble in sleeping could be there. And behavioral symptoms, it can people because of stress may stop going to social gatherings. They may go, they may be previously they may be interested in going to temple and meeting their friends and relatives. Some, they avoid all those things. Marriages they will allow, avoid. They they may, because of stress, they may involve in unnecessary arguments and fights, missing some minor mistakes in their work and poor performance. And some people may end up in substance use like alcohol, tobacco, and all to decrease the stress. So it can affect your mental health, mental or psychological. It can affect you. It can affect your body, and it can affect your behavior. But for distress, those who are having mental distress, the symptoms won't be persistent and pervasive. Means if you are having low mood, means it will be on end of low mood, and occasionally you will get low mood, and some on end of sleep disturbance may be there, irritability may be there occasional, but the symptoms won't be persistent and pervasive, and it won't cause that much socio-occupational dysfunction. If it is causing socio-occupational dysfunction and these symptoms are persistent and pervasive, and then means you are having mental disorder or mental illness. So is it clear? Anyone has any doubt in this?
Just feeling sad and irritable and aggressive.
Yeah.
I keep feeling sad. I don't know. And I just start crying.
So yeah, we need to further look into other symptoms and whether it is throughout the day we are feeling sad.
No, once in a way, maybe once into 1 week or 2 weeks like that, just for 10-15 minutes, then I'm okay. Then I forget about it.
Yeah, then we have to look into other symptoms like whether you are having sleep disturbance, different pains and all are there. Then it is normal thing, feeling sad occasionally, because if any issue is there, everyone feels sad for some time because of that issue. It is quite normal.
I lost my husband recently.
Yeah.
Maybe because of that. I don't know. What it is.
Madam, can you just switch on your video?
It is on only. It is on only.
It is on only. It is on.
I am able to see.
I'm not able to, because I can pin her. That's why I'm just asking.
So yeah, personal question we can take up later and
later. Yeah.
Okay.
Doctor.
Yes.
I was also coming to that point only. I have attended many presentations about mental stress among the aged. The lady just now mentioned she lost her husband. So in my case also, I lost my wife about 3.5 years back.
Yes.
So however much I want to forget, it keeps on coming back to me. So I keep, I become sad many times.
Yes.
How do we overcome that?
This I will come to later, whether we need to check whether you are having depression or whether you are having normal grief reaction. That we need to check. Yeah, that I will come to. As personal questions I will come later, because then we cannot proceed with this presentation now if we start addressing all these personal questions. So in old age, loss of spouse or partner is one major issue, and normal grief, it is common, and you will get the thoughts of the deceased person on and off. It is very common, and because of that you are getting on and off low moods. That is also very common. But whether it is because of these thoughts repeatedly it is coming, and your mood is low throughout the day, and your other biological functions, sleep, appetite is disturbed, and then we need to check whether you, then that means you could be having either mental distress or mental disorder. You may be having depression because of that. We need to check. We need to assess detailedly what all are the symptoms you are having. So it could be normal thing, or it could be a mental distress, or it could be a mental disorder also, based on the symptoms and its severity. So yeah,
Go ahead, go ahead. Go ahead, doctor.
so I am going ahead, and here I will be discussing how to deal with the normal stress. And I am not talking about mental disorders per se. How to deal with stress when it is excess than normal. That I will be discussing here. So there are certain healthy ways of dealing with stress and unhealthy ways of dealing with stress is there. So each of these I will come in detail. So healthy way of dealing with stress, one of it is efficient problem solving skills, and seeking support from others during challenges. Problem solving skills I will come in subsequent slides. Seeking support from others during challenges is very important. Many times, if you are having stress, many people don't communicate it to others. Communicating your problem with your to people who you are comfortable with, that is very important. You should communicate only to people who you are comfortable with. That is very important, and you should always do that. It is a big stress reliever. If you keep it within you, you are not talking it to anyone, then it may lead to mental distress and mental disorder. Communicating it with others is very important. It itself is it will solve majority of the problems. And regulating emotions, I will come to how to regulate the emotion. That will come to later in the subsequent slides. Taking care of the body and mind by doing yoga, exercise, and meditation. That is also very, very important. We are normally we people take care of our body by bathing and all, but we are not doing anything to our mind. Exercise and yoga or meditation are important to the body as well, but it has effects on our mind also. So we are not doing anything to take care of our mind. So regular exercises, yoga, meditation itself is very, very important. That is also a healthy way of dealing with stress. Effectively managing time and giving time to oneself. So this is more important for people who are working. For them, effective time management is very important. And you should find time for yourself. Many times you are busy in some or other activities and you are not devoting any time to yourself. Timing to devote time to yourself, finding time to yourself, to relax yourself is very, very, very important. And what all are the unhealthy ways of dealing with stress? Unhealthy ways of one is avoiding the situation, and other it's remaining aloof and not sharing with the problem, opposite to sharing the problem, involving in aggression, self-harm, violent behaviors, consumption of alcohol and substances. Many people do this. They think that alcohol decreases stress and it helps in improving the sleep. No, it is the other way. Like we are dealing with patients, alcohol itself can cause depression. It itself can cause anxiety. So consuming alcohol can even disturb your sleep also. Your sleep won't be proper if you take alcohol actually. Yeah, one second. Yes, ma'am. Can I come by 5 because that webinar is going on. Vayomanasa Sanjeevani. At 5 o'clock I will be going. Yes, ma'am. Okay, ma'am. Sorry.
No problem, doctor. No problem. We understand. Yes.
So consumption of alcohol and other substances like alcohol can decrease your immediately you will get sedated, you may sleep, but that sleep won't be deep, and next day you will be having remorse because of taking alcohol, and you may be having headache and all those things. And per se alcohol itself can decrease cause depression and other mental disorders as well. And another thing is the wishful thinking and blaming others that many people do, because they will start blaming others. And these are the unhealthy ways of dealing with stress. And so,
yeah, just 1 minute, doctor. Ramnath has asked one question.
Yeah.
Which is severe mental stress or physical stress? What is severe mental stress and what is severe physical stress?
So there is no terminology called severe mental stress. It is not there. Stress is there, mental distress is there, mental disorder is there. And severe mental disorders are there, and common mental disorders are there. Severe mental disorders are schizophrenia, bipolar affective disorders, severe depression, and all are severe mental disorders. Common mental disorders are anxiety, common depression, somatoform disorders. These are common mental disorders. There is
anxiety is only a common disorder.
Yeah, common mental disorder. It is not a common mental disorder. It is not a severe mental disorder. And it's yes, mild and moderate depression and all will be also are common mental disorders. There is no terminology called severe mental stress.
That's okay, doctor. Thank you.
So yeah, problem focus coping. Yeah, I didn't discuss about the problem focus coping. There are different ways of coping. I told this is one of the healthy way of coping. How if there is a problem and for it is more suitable for people who are much intellectual and they are not much emotional, then they can use this approach for dealing with the stress. The first step is identify and define the problem. What problem you are having, and generate all the possible solutions to the problem. And then evaluate and select the best possible solution and implement the solution and review yourself. This is a problem focused coping. If suppose you are having a problem, then many times we don't know what problem we are having. Identifying the problem itself is a very important thing. We may be having a number of issues, minor issues will be there, but we have to first focus on major issue. What is the major thing which is worrying you? So identifying that is very important. And even before that, you may be just having symptoms, like you may be having sleep disturbance, you may be having pain in the body here and there, but you may not be aware that you are having stress. Many people are not aware those symptoms like headache, on and off, low mood, irritability, some sleep disturbance. These are because of stress. Identifying that these are because of stress is the first step. And next step is identifying the problem, what problem you are having. Then you can even write in a paper or a diary. You can write that what all are the possible solution to this problem. Then you can evaluate each of these solutions. You can suppose you have solution A. Then what all are the possibility I could implement this solution. Whether if I implement, whether it could be successful or not. Like that, you can evaluate each of the possible solution. You can look into the advantages and disadvantages of each of the solutions, and finally implement the solution which you can consider the most suitable thing. And later you can review yourself. It is clear, I think.
Yes,
This
is clear.
approaching the issues if you are having stress.
Doctor, more problem is most of us seem to be emotional. The problem comes when we are emotional. You have talked about more intellectual, less emotional. In fact, the scenario is more emotional and less intellectual.
So like this thing also we can implement. We can combine everything actually. I will talk about emotional based coping also in the subsequent.
Please.
But we can combine both. Both are important actually. Okay. So the problem also is very important. No, sometimes problem don't have any solution. Many problems may not have solution at all. Like that also situation will be there. Not every problem will have a solution. Then we have to accept something. We need to accept also. Acceptance is also very important. Some problem don't have any solution. We have to accept that.
And try to live with that.
We have to accept ourselves and we have to cope up emotionally. Then I will subsequently coming to emotional focus coping. So this is emotional focus coping. Here one approach is that exit the situation. Distracting. Sometimes, for example, you have an altercate with your spouse. Then many times some people may not be able to regulate their emotion and end up in very severe fights. So to prevent that, one thing is that you get immediately out of the situation. You go from that situation and you can go to the bathroom, wash your face, or you can take a walk in the garden, or you can take a bath. You can do some other thing which you like, but get yourself out of the situation. That is one thing you can do. Another thing is stop technique. Stop technique, I will come in the next slide. And distraction techniques. Distraction technique is that you can distract yourself. There are a number of ways in which you can distract yourself. You can, for example, I already told, you can do mental calculation. You can count numbers from reverse order, from 100. You can subtract 9, like serially you can subtract, or you can do things which you like. Sometimes if you love listening to music, you can go and listen to music, or you can have a tea or coffee, or you can walk in a park or ground, distracting yourself. That is depends on the each and every person. It is unique to each and every person. What is effective for them? That you have to find out and try to distract yourself and ground yourself. Here it is taking a deep breath, and there is something called a sensory awareness. Here each of the things I am not detailing going on because it needs supervision also. You need to consult a psychiatrist or psychologist for each of these techniques, but I am basically touching these all are the techniques which are available. And suppose you can you can see, identify things you can see, hear, touch, smell, or taste. For example, if you are sitting on a chair, try to feel the sensation of the chair. Try to see what all are things around you, color of the surroundings, smell. If any smell is there, you try to find out, try to focus your attention on the smell. Or you can hear anything, whether you can hear voice. Sometimes you can hear birds chirping, or you can hear voice of the vehicle. You have to pay attention to the stimulus around you. In that way, you will get distracted. Or you can use some grounding object like a smiley ball. If it is there, then you can feel the sensation of the ball. You can touch and pressure. You can see the color, what texture. You can try to smell it. All those things. Or you can use a positive affirmation also. These are, I am just basically touching upon the topic. I am not going in detail. You need a professional help for this thing, and you have to be trained for that. And simple thing you can do is deep breathing. You can focus on your breath. You can breathe deeply, expand your abdomen more than your chest. Deep breathing is one way of emotional coping. And the other thing is Jacobson progressive muscle relaxation technique. These are 20 minutes muscle relaxation technique which we teach patients how to. The concept of is that if you contract muscles, then you can relax it much quickly. You cannot voluntarily. It is very difficult to voluntarily relax your muscles. And progressively you will start with different face. You will start your hands, abdomen, legs, and all. You will contract your muscles and feel the relaxation. And ultimately your mind also gets relaxed, and you will be able to feel stress gets relieved, and you will get good sleep after doing this exercise. And some people can listen to music and engage in spiritual activities. These are some of the emotion focused coping. There are some techniques called as mindfulness. You can do meditation, yoga. These are also helping emotion coping. Pranayama you can use.
Yes. Beautiful said, Doctor. The goal is not to get rid of all your negative thoughts and feelings. That is impossible. The goal is to change your response to them.
Yeah.
Thanks, Doctor. Thanks.
So these are some of the techniques which you can use. One thing is distracting yourself. Stop technique I will tell in the next slide. So stop technique means when you yourself notice yourself being stressed or overwhelmed, or first important step is pause whatever you are doing. That is the S stand for pause, stop technique. Pause, stop is pause whatever you are doing. It is essential to interrupt the automatic response to stress. Then you can take a next step is think. Take few deep breath. Then you can think yourself why you are feeling stress. Then you can identify the thoughts and emotions that are contributing to the stress. Next is observe. After identifying your thoughts, emotion, step back and observe them without judgment. Try to be an impartial observer of your inner own experience. That is difficult, little bit difficult. And you have to observe your thoughts without judgment. That means you need not think that this is bad thought, this is good thought. Don't judge that, just observe that. And next, once you have stopped, thought, and observed, and you can make a more deliberate and considered choice about how to proceed. If you observe them non-judgmentally, then you can make a better choice how to proceed. You might need to take a break, reframe your thoughts, or choose a different, more constructive response. So this is the stop technique. First, you pause yourself, then relax yourself, ask yourself why you are feeling stressed, identify the thought and emotion that are contributing, then observe the thought non-judgmentally, and make a deliberate choice how to. Then you can choose what to do to decrease the stress.
Doctor, our Changarai sir has asked one question. Stress. More stress, is it reason for, more affection Is it a reason for stress?
More affection.
Is it a reason for stress?
More affection, it is not a reason for stress, but expectations is a reason. You may be expecting so much from some other people. So if they are not matching your expectation, then you may get stress.
Yeah, because of more affection.
If you are affectionate, being affectionate itself is a sweet emotion. If you are loving someone, if you are loving your pet, dog, you are watering trees, you are loving even trees also, that itself is a sweet emotion. It won't create stress. Being affectionate or loving itself is good to you, rather than we don't know whether it will be good to others, but definitely it is good to you.
Doctor,
May I say that
reciprocation. I mean, reciprocation from the affectionate people is not adequate. That is for one reason for stress.
Yeah, definitely. That is correct.
One-side love. I can say one-side love or one-side affection or one-side help or one-side consolation. The other side also have to reciprocate.
So that is what doctor said, that it is expectation.
may I say attachment is the one which causes.
Attachment is not that. When you are, because of attachment, when you are expecting something, and
No,
that
over a period of time you
doesn't happen.
get attached
Yes.
emotionally or whatever the cause.
I would like to quote something from Bhagavad Gita. There is something called a Nishkama Karma. It is known as Nishkama Karma, doing karma without any expectations. Expectations is the one which is the cause for suffering actually. If you are doing your work, then without any expectation, definitely it won't cause stress. But as a human being, it is very difficult to reach in that state. But
God's version is different from human version.
Yes. No, yeah, that is advice for human beings, but but
God is different.
it's very natural for us.
Lord Krishna is for above all. Every ordinary person cannot go like
I am
that.
telling about the advice to Arjuna. Krishna is advice to Arjuna. It is applicable for all people also. You should do work without any expectations. But it is very difficult to achieve that state, but we can try for that. That is the only thing. But important thing is that we should try decrease your limit our expectations.
Yes.
Important. If you are having unlimited expectation, then we will end up suffering.
No. That's why not expectation for kind or money or wealth or so anything else. Kindness, only kindness, sir. We are seniors are expecting because we are having some money, pension and other things. Nothing is expected from anybody.
So that is one important reason for stress, because the family members are not showing the care that we deserve, or they are not showing kindness or compassion. That will create stress. Definitely it will create stress, but we should find out, try to cope up with that. Sometimes we cannot find a solution for that.
We cannot compel also.
We cannot compel also. There may not be solution also, and we can think about solution also. In the case of we are having no solution, then we have to cope up with our emotions and accept the situation. That is very important.
Real friends are having friendship,
and that's why
conversation like that.
Yes, we can share our thoughts with others. We can form if you have a peer group, you can share to other. If you are a partner, you can share to your partner. That sharing is very important, and also you can try to relax yourself. Try to do pranayama. Try to keep yourself busy.
Reading books, like that. We have to adjust with us.
Yeah, but if the stress is too much and it leads to mental distress or disorder, then we have to take a professional help also. It is very important. If you are having mental distress, you are not able to cope up with that, then definitely you have to seek help, professional help. Don't shy away taking professional help. That happens many times. We don't take professional help if we are not able to cope. If we are able to cope, then no need to take any professional help at all.
Thank you, Doctor.
Thank you. So lifestyle changes. So this we know actually, having a fixed daily routine, it is very important, and at least 7 to 8 hours of sleep. But it is not applicable to people who are above 60 years. Many times people above 60 comes to us, we are dealing with geriatric population. So they will be telling that one major complaint is decreased sleep. So yeah, what I want to tell is that you don't expect these 7 to 8 hours of sleep in after 60 years. Your sleep decreases once you grow old. 6 hours of sleep is fine in elderly, and if you wake up 1 or 2 times, it is absolutely normal. Many times people will be worried that they are getting only 6 hours of sleep and I am getting 1 or 2 times in the night. It is absolutely normal if you are not having any fatigability during the daytime, and then it is absolutely normal thing. And
food habits, eating habits have to be regulated.
yes, food habits, it is very important. Yeah, like consuming lots of vegetables, fruits. It is very important to have a nutritious food. Also is very important. And many times in elderly, we'll have so many gastric complaints as well. So yeah, I advise yourself, all people to take dinner at least 2 hours before you go to sleep. And try to make the night dinner light. Don't consume so much oily food, fat food, and so much spices in the night, because it can cause gastroesophageal reflux, and it can cause.
But sometimes you get hungry in the midnight.
Hungry in the midnight. That's okay, but what happens if you consume food immediately and if you lay down? No, already you may be having gastric problems and all. It will aggravate those gastric problems, and your sleep also will be disturbed. Many people think that if you take full meals and if your stomach is full, then you will get good sleep, but the quality of the sleep will be poor. So it is better you take dinner 2 hours before going to bed, and try to make it less spicy, less oily, try to make it more healthy, and try to involve nutritious foods, more fruits, vegetables, and is advisable. And time management skills, it may not be applicable much to people who are retired, and sparing time for hobbies. That is also very important. You should try to involve in some hobbies, whether if you are interested in some games or some hobby, whatever you like. Some people may be interested in going to temple also. That could be a hobby involving in spiritual activities, and anything which you like, and avoid substance use. That is also very important.
I want to share a few points, Doctor.
Yes, sure. Please.
ನಾವು ಡಾಕ್ಟರ್ ಮಹೇಶ್ ಹೇಮಾದ್ರಿ ಅಂತ ಮಾತಾಡೋದು ಅಬುದಿಂದ.
ಹೇಳಿ.
ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡ್ಬೋದಾ?
ಮಾತಾಡಿ ಸರ್. ತಮ್ಮ ಹೆಸರು ಸರ್?
ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡಿ, ಏನು ತೊಂದರೆ ಇಲ್ಲ
ಸರ್. ತಮ್ಮ ಹೆಸರು ಸರ್?
ಒಂದು 2 ವಿಷಯದ ಬಗ್ಗೆ ಹೇಳ್ಬೇಕಾಗಿತ್ತು. ಒಂದು, ಯಾರಲ್ಲಿ ವಿಟಮಿನ್ ಡಿ ಕಡಿಮೆ ಇರುತ್ತಲ್ಲ, ಸೊ ಅವರು ಮಾನಸಿಕ ಒತ್ತಡಕ್ಕೆ ಸ್ಪಂದನ ಮಾಡುವಂತ ಶಕ್ತಿ ಕಡಿಮೆ ಇರುತ್ತೆ.
ಸರಿ.
ಸೊ ಅದಕ್ಕೆ ಇದೊಂದು ದೊಡ್ಡ ರಿಸರ್ಚ್, ಇದು ಅನುಸಂಧಾನ. ಯಾರಲ್ಲಿ ವಿಟಮಿನ್ ಡಿ ತಮ್ಮ ಶರೀರದಲ್ಲಿ ಚೆನ್ನಾಗಿ ಇಟ್ಕೊಂಡಿರ್ತಾರಲ್ಲ, ಮೋರ್ ದ್ಯಾನ್ 30 ನ್ಯಾನೋಗ್ರಾಮ್, ಮೋರ್ ದ್ಯಾನ್ 40 to 60 ಒಳಗಡೆ ಇರಬೇಕು ನ್ಯಾನೋಗ್ರಾಮು. ಸೊ ಅವರು ಮಾನಸಿಕ ಒತ್ತಡಕ್ಕೆ ಸರಿಯಾಗಿ ಸ್ಪಂದನ ಮಾಡ್ತಾರೆ. That is research. There is evidence based research.
Yeah. What you are speaking is true only.
ಎರಡನೇದ್ದು ಸಂಗೀತ ಕೇಳೋದು. ಸಂಗೀತದಲ್ಲಿ ವಿಶೇಷವಾಗಿ ದರ್ಬಾರಿ ಕನ್ನಡ, ರಾಗ ದರ್ಬಾರಿ ಕನ್ನಡ ಮತ್ತು ರಾಗ್ ಪುರಿಯ, ಈ 2 ಸಂಗೀತಗಳನ್ನ, ಈ ರಾಗಗಳನ್ನ ಪ್ರತಿನಿತ್ಯ 30 ನಿಮಿಷ ಕೇಳೋದ್ರಿಂದ ಮಾನಸಿಕ ಒತ್ತಡವನ್ನ ಅದನ್ನ ಸಂಭಾಳಿಸುವಂತ ಯೋಗ್ಯತೆ ಬರುತ್ತೆ, ಚೆನ್ನಾಗುತ್ತೆ. ನಿದ್ದೆ ಚೆನ್ನಾಗಿ ಬರುತ್ತೆ, ದೆನ್ ಮತ್ತೆ ರಿಲೇಷನ್ಸ್, ಎಮೋಷನಲ್ ರೆಗ್ಯುಲೇಷನ್ ಚೆನ್ನಾಗುತ್ತೆ.
Yes, you are true only, sir. You are correct.
So for the benefit of all the people
only listening to music, especially classical music, not the pop music. Classical music is it will create lot of it will decrease mental distress. Definitely it can decrease, but per se it is not a treatment for mental disorders. If you are having depression, just by listening music, your depression won't go away, but it will help you decrease your mental stress, and it may help in conversion of mental distress to disorder. It will help in relaxation. That is a healthy lifestyle you can. That depends. If you love music, definitely it helps.
Sir, for the benefit of all the people who cannot follow Kannada, because this is a seminar where people from all over the country are participating.
Okay.
I think I will just translate. I mean, you can. Just translate. Yeah.
Yeah, he told that there is a research finding that if vitamin D is less, then then it can if you supplement vitamin D to people who are having less vitamin D, then it can improve your mental health. That some researchers it is there even for people who are having mental disorders like schizophrenia and all, depression and all. If they are supplementing vitamin D, it can help in improving their mental state. And the other thing he told, listening to music. That is classical music, some special raga he told, and that definitely help in your mental health. If you want to add, Jambunathan sir, you can add.
So we have substantially covered all the points. We have covered. So the only thing is that he was talking about some numbers. This is with regard to the
Music.
vitamin D. He was telling some numbers. I really don't know what is the test available for vitamin D.
Vitamin D, you can measure serum vitamin D level. Yeah, you can. It will cost around 600 rupees and all. Yeah, you can measure it, but many times no. Even for normal people also, it will be less.
Yeah, because that is one thing I have found, that Doctor. One thing is that although we are in very funny situation, most of us are suffering from less of vitamin D.
Yeah.
Most of us.
Yeah. If
the vitamin D deficiency is almost very common.
Yeah, it is very common, and if many people may have, but for people who are having mental disorder or distress, if vitamin D is less, if it is better, you can supplement yourself with that. There are syrup forms available, which you can take every weekly, mostly. Vitamin D syrup is available, 60K in the
D protein with milk, doctor. Doctor, are you hearing?
Yes.
D protein with milk, 1 cup is necessary. So somebody was telling.
No. We are in already prescribes. Yeah, we have to give 60,000 international units. Yeah, of vitamin K. We normally we give syrups, and apart from syrups, sachet is also available. That better you consult a doctor. We will prescribe normally. We prescribe for, you can check yourself if you have vitamin D deficiency. But for prescription, you consult a doctor. Otherwise, many people will tell many things.
Yes.
There is a particular dose, particular frequency you have to take. All those things are important in net, and if people suggest, they will tell some random things. For medications, even if it is with vitamins also, the proper dosage is needed. So other thing is that sleep hygiene. Sleep hygiene is many people are not following proper sleep hygiene techniques. Because of that, they have sleep disturbances. So one most important thing is that prioritizing the sleep. You should keep sleep most important thing, and fixed sleep wake timings. You should try to sleep at one particular time and wake up at another time. In a particular time in the day, in the early morning. And another time is most important thing is that avoiding daytime sleep. And if you sleep during the daytime, definitely your night sleep quality as well as quantity will be affected. That is very important. We normally have this habit of sleeping in the daytime. Especially it is important for elderly, that try to avoid maximum.
Even short nap is cannot be avoided.
Very short nap, it is fine. Yeah, if it is not disturbing your
half an hour or so.
Night time. If it is disturbing your night sleep and you are then I suggest that better to avoid that also. If it is not disturbing your night sleep, then it is okay. Short nap is good. It is okay. It help you relax and charge. But if it is disturbing, you are already having sleep disturbances and you are sleeping in the daytime, better to avoid that. It has an effect. And try to avoid screen before night. Many times people are using nowadays mobile phones, TV. All people are using the screen, computer, everything, because the screens. If you are seeing TV, mobile phone, and all, it has a light. That light will affect your sleep, quality of sleep. So try to avoid screen, especially during the night time. At least 30 minutes to 1 hour before sleep. Try to avoid using mobile phone or TV, computers for at least 1 hour before going to sleep. And getting good daylight exposure and physically active is also very important. Many times we won't be active throughout the day. We'll be sitting, we'll be eating food and relaxing yourself. Then definitely you are not that tired, and you won't be getting that good sleep. For people who are having sleep disturbance, some physical activity is very important. It is very important that you need not be physically active after 6 p.m. in the night. I am not telling that, but you can be active during the daytime, and also evening you can go for walk and all. Not during the night after lunch and all. If you start doing exercise, then it will disturb your sleep. No, should not do like that. And definitely you should avoid the substances which can smoking, BD, cigarette, tobacco, alcohol. These things should be avoided, and restricting caffeine intake. Like tea and coffee. Tea and coffee are stimulants, definitely. It will decrease your sleep quota, decrease your quality of the sleep. So restricting the tea, coffee, especially avoid during the night time. Now, don't take tea and coffee during the night time. That is very important. And use the bed only for sleep. And other important thing is that if you are not feeling sleepy, if you are staying in the bed more than 20 minutes, then get up from the bed, try to read some book or try to do deep breathing. That you can do. No, don't stay in the bed more than 20 minutes. If you are not getting sleep more than 20 minutes, just get up from the bed. Just try to sit yourself, relax yourself, try to read something. Don't use your mobile phones. And I had already mentioned that avoid sleeping immediately after eating. So these are some of the sleep hygiene techniques which are very important.
Doctor, can I share just one technique?
Yes.
Supposing somebody, I mean, this is again proven by NIMHANS studies.
Yeah.
And we always used to, we always used to advocate that. In case somebody is not getting sleep, then they can try left nostril breathing. Close the right nostril, breathe only through, inhaling and exhaling only through the left nostril. Say for about 5 to 10 minutes. 100% you will get sleep.
That is a yogic technique. Yes, it is a yogic technique. It is part of yoga. So better, better consult a yoga practitioner for the exact method of doing that. Because yoga, if you don't do properly, it can.
It is likely to affect, but only for sleeping purpose. Just 1 or 2 occasions they can try this.
They can try. But it is a yogic technique actually.
It's a yogic technique. And this has been recommended by NIMHANS, and even your own doctors recommended that.
NIMHANS research has gone.
Research has shown that this
integrative department. There are certain practices in yoga for depression as well as for anxiety as well as researches has been done in NIMHANS for those practices. They have NIMHANS also has developed modules, yoga modules for depression, anxiety and all. And what I want to tell is that if you want to do anything related to yoga, you should take help. Proper guidance is needed. If book yoga should be avoided totally.
Exactly.
Doctor, one point. Hello,
Doctor. Tell me, sir.
I see. I get sleep within 5 minutes after going to bed, but after 2-3 hours, I wake up and then I cannot get sleep. You can call it a fragmented sleep or whatever the terminology. I don't know. And,
so after 2 to 3 hours, you are not able to sleep at all.
Yeah.
You are only you are getting 2 hours of sleep in the night time.
Yeah, and then sometimes after somewhere in the early morning 4:30 I get sleep. Sometimes I don't get at all. That is, as you rightly said, 2 to 3 hours sleep per day. That causes, and why that fragmented sleep is causing is.
Definitely you should consult any psychiatrist or because 2 hours is very less time. There will be multiple reasons. Maybe your sleep hygiene, one thing you can do, try to follow the sleep hygiene techniques. And you may be having mental distress or mental disorder. We don't know. So we have to evaluate. Definitely 2 hours is very less time. We need to evaluate the cause for the sleep. Finding out the cause for the sleep is very important. Sometimes even medications could be the reason. But we need to check why the sleep is.
No, I don't take any medicine for
that. I am telling just telling only. There could be n number of reasons for that.
Oh, thank you.
Okay, thank you. If anyone has, my slides are over.
Your slides are over, Doctor. Anybody has?
I would like to
raise some questions.
One more thing I would like to tell. If you are having any of those symptoms, like if you are having any mental distress symptoms, like if you are having on and off low mood, multiple body aches, and concentration issues, memory issues. You should definitely seek a professional help. That is very important. And if it is interfering with your day-to-day activities, and if it is interfering with, it is causing personal distress, and if you affecting your relationship with other people, family members, and it is affecting you professionally, definitely you need to take a professional help. You may be having normal mental distress that can be addressed, and you may be also having mental disorder, because mental disorders are very common. I told no, it is 10% of the population are having mental disorders, and maybe it could be small, something like anxiety disorder, depressive disorder, but it needs treatment, and you should not shy away from consulting professional, taking a professional help. And where you can consult, next question already. One thing is that there is something called as a district mental health team is there. Every district a psychiatrist is available, district hospital men. Every district psychiatrist is available, and also there is separate district mental health team which will be visiting each taluk hospital once in a month. That is available near your home. And even you can consult a local PHC. PHC में primary health doctor will be there. They will also advise when psychiatrist is coming to the taluk hospital. You can get the contacts from them. That is the nearest best thing you can do. You need not come to NIMHANS for each and everything, because NIMHANS is a tertiary care center, and the crowd also will be very huge, and you may have to travel long distance. First, you can take treatment from your primary care settings. You can, each district has a psychiatrist, and also there is a DMHP team which will be visiting each taluk hospital once in a month. And if you are not able to find the details about it, just contact a nearby primary health center. Primary health center will be nearby your home. There, they can guide. Also, the ASHA workers also are there. Each ASHA workers, they will be there. Each PHC has many ASHA workers. So you can contact any of the healthcare professionals and inquire about when psychiatrist is coming.
So,
And another thing which we are dealing with geriatric psychiatry, apart from the mental disorders which we find in younger people, something called as dementia, which is very common in elderly people, and it is more so. If any of your friends, family, relative, known people who are having significant mental memory disturbance, you can refer to a psychiatrist, so that we can screen whether the person is having dementia or not.
One need not feel anything, embarrassment for contacting a psychiatrist. That
No,
I think, yeah. See,
that is important. That is very important. No need to shy away.
yes.
If you go to a general hospital, for example, a psychiatrist will be coming in each taluk hospital once in a month. You are just going to general hospital. No, you no need to shy away. Also, no one will know whom you are consulting. Even psychiatrist or just general hospitals also, psychiatrist is available. You need not come for small issues to NIMHANS. You can consult every taluk hospital. Psychiatrist is coming once in a month, and each district there is a psychiatrist. District hospital there will be a psychiatrist.
So for mental health has the facility for mental health has improved. Government has taken lots of initiatives, and once upon a time these psychiatrists were all not available. They were available only in towns and cities. Now they are available almost everywhere. Only thing is, yes.
So there is one thing called as elderly helpline also is there, 1234567. That is the number. You can call that anytime you want. It is a national helpline. Elderly helpline is there, and there is something called as NIMHANS that recently has been launched.
Yes.
Number is 14416. It is available 24/7. NIMHANS services. Anytime you can call 14416 from your phone, and you will be able to, you will be diverted to the different first the call will be taken by the counselors based on your language. If you are Kannada speaking, then the call will be taken to a Kannada speaking counselor. Then based on they will screen, and if you are having any mental disorder, then your call will be connected to the psychiatrist. So this is the thing which recently government has started. That is NIMHANS, National Telemental Health Program, and the number is 14416.
And 14567, that is
elderly helpline. Elderly helpline is number is 1 second.
14567. Any kind of elderly issue.
14567 is the elderly helpline.
Yeah, 14567. Any kind of issue
Sir,
can be
this is 14416, sir.
14416 is Telemanus. That is a national telemental health program. That helpline is available 24/7 services. In some of the state, majority in Karnataka, it is available 24/7. Some states it is not available 24/7, but it will be in process. It is in process. But Karnataka, Kerala, it is available. Many of the states it is available 24/7.
In addition to that, 14567 is also available. That service is between 8 a.m. and 8 p.m.
Yeah.
That is available all the states, and in all the languages it is available.
Yeah, and if you have any legal issues also, your children are not taking care, then also you can contact the 14567. They will help in resolving those issues also. 14567. And if you have pure mental illness or disorders, then you can contact 14416.
That is Telemanus.
Yeah.
Any other?
Help you want elderly, the elderly helpline you can call. Even you are not able to travel, also you are having very sick, you are not able to travel, you need urgent help, you can call that 14567. That is for elderly health, not only for mental disorders, it is for all type of help for elderly.
Dr. Mr. Putana Gowda has asked a beautiful question. Is psychiatrists alone sufficient enough in numbers to provide consultation in the community with current condition and prevalence rate of elderly care issues? What are the alternate options?
So yeah, what we are doing from NIMHANS is that we are training different cadres of healthcare workers, training them how to identify and screen for mental illness and provide primary care psychiatry. So we are training medical officers, we are training nurses, we are training ASHA workers, all those, and even pharmacists we are also training. So we are training different cadres of people, health workers, so that they can identify the mental issues and screen and provide basic treatment, and also to the pathways to refer also we will teach them how to do that. Definitely the number of psychiatrists and even psychologists or social workers are less. So we are training different cadres. And also I already told, we are training lay people also we are training for helping people who are having mental distress. We are running a course from NIMHANS called online certificate course on lay counseling, where we will be training lay people how to identify mental illness and how to provide basic supportive counseling. We are training them also. So that because people who are having mental distress, the prevalence is around 30 to 40%, and it is very huge. Definitely the healthcare workers cannot target such a huge population. It is roughly 1/3 of our country, no. So we have to train people from our community who are willing to volunteer to help their fellow people. So we are doing many things, but it is not still sufficient. It is a very big challenge in the initial stages only. So anyone has any other more questions?
Any other person needs any other questions, sir? Ladies, gentlemen, have you got? Doctor, can I share your number, doctor? Because many of them have asked for your number. I have not shared it because I don't want to share it without your consent.
So yeah, like you can come to NIMHANS OPD any time if you want to come here.
Yeah, that is
if I share my number means I will be having because I so many calls.
I can share Vayomanasa Sanjeevani official number here.
Yeah,
okay.
That you kindly share, ma. Vayomanasa official number you share, so that anybody needing. But you know right now the number of calls. The numbers available are with you. 144-567. That is one, and Telemanus 14416. They are all providing lots of service.
Yeah, Telemanus you can call any time in a day. 14416 is the Telemanus number. Anytime you can call.
Anytime one can call, and they give lots of support.
Yeah, 14567 for elderly. Any issues related to elderly. If you are having any issues, whether you are facing domestic violence or any other legal issues, property issues, you can call 14567. And mental health related issues, definitely you can call 14416.
And in doctor, to be very honest, we ran a specific program for this 144567. 14567 program alone. We ran a program here. We ran a program in Tamil as well as in English.
Yes. Yes.
So I think people must be very here. If there are no other questions,
We can wind up. I think it is.
because doctor needs to go for his evening OP. People will be waiting for him. Any other questions, sir? Any other ladies, gentlemen? If there is no other question, yes, let me conclude. Doctor, thank you very much. Thank you
everyone for your wonderful participation. You people are asking questions also. You are actively listening also. It is my pleasure to deliver this lecture. Thank you everyone very much. Thank you, Mr. Jambunathan sir, for organizing this lecture, and thank you for inviting me.
Thank you, doctor, for all participants.
Thank you, Doctor. Just before I hand you over to the studio, see, it is our duty to thank you for the time and the knowledge you have shared. In fact, many people in the chat have expressed that we wanted to have your number. We wanted all your, whatever presentations you have given. In that, is it possible? In fact, for all of them, my answer is that this topic, this session will be uploaded in YouTube. We have got a VMS YouTube channel. Please go to VMS YouTube channel. Not only for this seminar, you can see other presentations also. See, in fact, so far we have done about 300 presentations in 3 different languages. We conduct these webinars in 3 languages. One is in English, another in Tamil, and third one in Kannada. So we have been doing it for some time in Hindi also. But somehow or other, Hindi, we could not get many people. Therefore, we have stopped that. Therefore, these 3 languages continue. Therefore, please visit our VMS webinar series, YouTube channel. You can see all our past webinars. And one thing I tell you is that, see, these are all webinars being organized by highly experienced and educated doctors. See, getting an MD seat in AIMS is not an easy job. The doctor has how much education, how much study he has done after his education in MBBS, from MBBS in Pondicherry, from Pondicherry. He has to concentrate for almost 1 year for entire preparing for the MD. And he has joined the MD course and he has finished his MD course and he is able to spend 1 hour time with us. That's something great. Therefore, my only request is that please tell all your friends about these kinds of seminars. Please ask them also to join. Let's all be benefited, and let's all become some kind of a lay counselor so that we can share our knowledge with others. Especially in case of our family members, our close friends who are facing some kind of mental issue. So that will be very helpful. Thank you, doctor, from our side for what all you have done is we can only pray God to shower on you and your family all that are the best in life, doctor. That is the only thing that, yes.
Thank you.
Okay.
So,
okay.
Thank you, doctor.
Thank you very much.
Thank you.
Thank you very much, sir.
Nisha,
Yeah, sir.
you can close down, ma.
Okay.
Yeah.
Thank you. Thank you very much, doctor.
Lot of thanks.
Thank you, Nisha. You can also show your face, ma. You are not showing that.
Yeah, my video.
Yeah, please do come. Please do come. Like
Video
that.
is on, sir. You can't see. My video is on.
Your video is on, huh?
Yeah.
Yeah, let me see. Let me see.
Sir, thank you very much.
Thank you. Yeah. Yes, I'm just, yeah. I'm adding.
Thank you very much. Thank you very much.
Yeah. So, Nisha is the person behind the venture. She is the only person who is providing us all the technical support. She is, she is a student in NIMHANS. So this entire program is done through only volunteers. There are no appointed people for that. So Nisha is one. In fact, it was being done by an earlier batch. Now Nisha has taken over. So we will wish her all the best on behalf of all of you. I am wishing Nisha all the very best in her career, education, and let her do more of these presentations. Thank you, Nisha.
Thank you, sir.
Thank
Thank you for everyone for participating.